So there are 4 different parts to Medicare. What should a new retiree know about these different parts to the Medicare system?
You're right, there are 4 parts. It's like the alphabet soup. We have Part A, Part B, Part C, and Part D. Part A is what pays 80% of your hospital bills. Part B pays 80% of your physician, your doctor bills, and it also pays for some inpatient and outpatient procedures. Part C is known as your Advantage plans. And of course, Part D is the most recent, created several years ago, and that's for your prescription drug plans.
What are the nuts and bolts of Medicare Part A?
Part A covers 80% of your hospital bills. Well, who covers the other 20%? And that's you. You're financially responsible for that.
Do you have to pay a premium for Part A?
No, Part A, there is no premium because you've paid that while you've worked. Now, if by any chance you are never worked and you're 65 years old, or you are from a foreign country, you're not a citizen of the United States, you can still get Part A by paying a premium. So even though you've never paid into the program before, you still have that option.
Do those people have to meet a deductible?
Everybody's going to have a deductible that they pay for Part A and Part B before the plan kicks in and pays at that 80%.
Well, that's just what I was going to ask you. Could you tell us some more about Medicare Part B?
Medicare Part B will pay for your physician bills, and it will pay for some inpatient and outpatient diagnostic tests that you have. And then you would be responsible financially for the 20% balance due.
If you choose A and B, then are there any extra things you might need?
What you might want to do, and we highly suggest this, is that you look into purchasing what's called a Medigap or a supplemental insurance policy. Now, you will pay a premium for that, but that policy then will pay that extra 20%. For example, let's say you're healthy at age 65, but what happens at 68 when you have a massive heart attack? Now, a heart attack can cost you a lot of money. Let's say you've run up medical bills of $100,000. Your Part A and Part B is going to pay 80% of that, but you're financially responsible for over $20,000. And who can pay that out of your checkbook today? Where your supplemental insurance company will pay for that for you.
That sounds like a whole lot of money. Can you tell us some more about Part C?
Part C is also known as Medicare Advantage plans. Now, what that means is a Medicare Advantage plan is the same as Medicare Original A and B. People get confused on that. They think if they have an Advantage plan that they're no longer with Medicare, and that's not true. The Advantage plan is just managed by private insurance companies. Now, the advantage to the Advantage plan is that it will cover Part A, Part B, and many of your Advantage plans cover some of your prescription drug costs of Part D. So it's all rolled into one. It's like one-stop shopping for your Advantage plans. Now, there are some disadvantages to that you want to look at as well, because sometimes you have to go to the physicians on the list, on the network, and hospitals in the network. So that's one of the things to look at when you're choosing which direction you want to go.
In Medicare Part D, that covers the prescription drug programs. And how does that work?
Prescription drugs under Part D, when you turn 65 and you go on Medicare, you are required to purchase a Part D plan, and that will cost you a premium. And that plan, depending on which plan you choose, will pay a percentage of your drugs. Now, if you elect not to purchase that plan, many people we run into, I'm healthy. I don't have any prescription drugs. I'm not going to pay a monthly premium for this plan. But you have to remember that this is an insurance, just like any other insurance that you carry. This is in case anything happens down the road. Remember when you have the heart attack at 68, now you've got drugs that you've got to pay for. And if you don't have the prescription drug plan, Part D, you're going to have to pay all that out of your own pocket.
There seem to be so many things to consider when making decisions about your Medicare coverage. How can a Shine volunteer help?
A Shine volunteer can help. We have many, many hours of training put into learning all about Medicare, Medicaid, Part D prescription plans, the Advantage plans, and we're all volunteers. We're here to help you. and it's a free service. You call the Shine hotline, and a Shine volunteer will respond to your question and help guide you, work you through the system to get the best results for whatever needs you have that need to be met as you age.
You can speak to a Shine volunteer by calling the Elder Helpline at 1-800-963-5337 or visit our website at www.agingflorida.com.